Hey everyone, and welcome back to Study Nurse IQ. I'm Jeannie, and today we're going to break down cystic fibrosis, CF. This is a complex genetic disorder that you'll definitely see on the NCLEX and in your nursing career. We'll cover the pathophysiology, signs and symptoms, and essential nursing care with a quiz at the end to lock in your knowledge. Let's get started. What is cystic fibrosis? Cystic fibrosis is a genetic disorder that is inherited in an autosomal recessive pattern. It occurs due to a mutation in the CFTR gene, which affects how cells produce mucus, sweat, and digestive fluids. The hallmark of this condition is the production of abnormally thick, sticky mucus that causes problems throughout the body. In the lungs, this thick mucus creates an ideal environment for bacterial growth, leading to frequent infections and progressive damage to lung tissue. It primarily affects the lungs, but it can also impact other organs throughout the body. The pancreas is similarly affected, with blocked ducts preventing crucial digestive enzymes from reaching the small intestine. The manifestations of cystic fibrosis are diverse and affect multiple body systems. In the respiratory system, patients typically experience persistent coughing with thick mucus, frequent lung infections, and progressive difficulty breathing. Over time, they may develop a barrel-shaped chest and clubbing of the fingers due to chronic oxygen deprivation, delayed growth, and malnutrition due to poor absorption of nutrients. Integumentary symptoms: skin. A key sign of CF is that the patient's sweat, saliva, and tears have a high sodium chloride content. Their skin will often taste salty. Gastrointestinal symptoms are equally significant, with patients often experiencing malabsorption issues leading to poor growth and development. A characteristic sign is steatorrhea, fatty, foul-smelling stools that result from the body's inability to properly digest fats. Diagnosis of cystic fibrosis typically begins with a sweat chloride test, which measures the concentration of salt in a person's sweat. This test remains the gold standard for diagnosis, as people with CF have significantly higher levels of chloride in their sweat. Additional diagnostic tools include genetic testing, which can identify specific CFTR mutations, a stool analysis to check for fat content, and various pulmonary function tests to assess lung capacity and function. Treatment for cystic fibrosis requires a comprehensive, multifaceted approach. Airway clearance techniques, including chest physiotherapy, CPT, and postural drainage, are essential daily treatments to help remove thick mucus from the lungs. CPT uses percussion, vibration, and postural drainage to help loosen and clear the thick mucus from the airways. Medications play a crucial role, including bronchodilators to open airways, mucolytics to thin secretions, and antibiotics to fight frequent infections. Pancreatic enzyme replacement therapy is typically necessary with all meals and snacks to aid in proper digestion and nutrient absorption. Oxygen therapy: administer oxygen as ordered to treat hypoxemia. Nutritional support: encourage a high-calorie, high-protein diet and provide fat-soluble vitamin supplements, A, D, E, K, to combat malnutrition and malabsorption. Hydration: encourage the patient to increase their fluid intake to help thin respiratory secretions. Nursing tip: schedule CPT before meals or at least several hours after to prevent vomiting. You should also administer a bronchodilator 30 to 60 minutes before CPT to open the airways and make the therapy more effective. Nursing care for CF patients focuses on both immediate symptom management and long-term health maintenance. Key interventions include monitoring respiratory status, ensuring proper nutrition and hydration, and administering prescribed medications correctly. Patient education is crucial, particularly regarding the importance of adherence to treatment regimens, proper nutrition, and early recognition of complications. Nurses must also be prepared to provide emotional support, as living with a chronic condition like CF can be challenging for both patients and their families. Prevention of complications is a critical aspect of CF care. This includes maintaining good hydration to help thin secretions, following a high-calorie, high-protein diet supplemented with fat-soluble vitamins, and ensuring regular exercise as tolerated. Regular monitoring of weight, respiratory function, and nutritional status helps identify and address problems early, potentially preventing more serious complications. All right, let's see what you've learned. Here are 3 quick NCLEX-style questions to test your knowledge. Question 1. A nurse is caring for a patient with cystic fibrosis. Which of the following findings would the nurse expect to note during the physical assessment? A. Bradycardia and hypotension. B. A foul-smelling fatty stool. C. Dry nonproductive cough. D. Normal growth and development. Correct answer B. A foul-smelling fatty stool. Rationale. The thick mucus in cystic fibrosis blocks the pancreatic ducts, preventing digestive enzymes from reaching the intestines. This leads to malabsorption of fats, resulting in the classic symptom of steatorrhea, which is a fatty, malodorous stool. Question 2. The nurse is providing patient teaching for a client with cystic fibrosis regarding their pancreatic enzyme medication. The nurse should instruct the patient to take the enzymes. A. With a glass of water 1 hour before meals. Only with large meals, not snacks. With all meals and snacks. D. Once daily in the morning on an empty stomach. Correct answer C. With all meals and snacks. Rationale. Pancreatic enzymes are essential for the digestion and absorption of nutrients. Because the mucus plugs the pancreatic ducts, these enzymes are not available naturally. They must be taken with every meal and snack to help the patient's body properly digest food. Question 3. A nurse is preparing to perform chest physiotherapy on a patient with cystic fibrosis. The nurse should schedule the procedure. A. Immediately after the patient eats breakfast. B. Before the patient's midday meal. C. After the patient has an exercise session. D. Right after the patient takes their bronchodilator. Correct answer B. Before the patient's midday meal. Rationale. Chest physiotherapy should be performed either before meals or at least a few hours after to avoid nausea and vomiting caused by the vigorous movements of the therapy. Additionally, bronchodilators should be given 30 to 60 minutes before the procedure to open the airways and improve the effectiveness of the therapy. And that's our deep dive into cystic fibrosis. I hope this video helps you feel prepared. Remember to like, comment, and subscribe for more nursing made simple content.